Hello everyone and welcome back to another lecture in the series of shock. In this series, we are discussing the details of each type of shock, their approach, how to diagnose, how to manage. So everything will be discussed in this series. So stay tuned for upcoming lectures. So let us start. There are four types of shock which are quite important for us to know. The first one is distributive shock. The second one is obstructive shock. Third one is hypovolumic shock. The fourth one is cardiogenic shock. So in the bracket ones, we have the causes of distributive shock like liver failure, sepsis, anaphylaxis, adrenal insufficiency, and pancreatitis. So the most common one in distributive shock is sepsis. Obstructive shock, we have massive pulmonary embolism, cardiac tamponade, tension pneumothorax. In hypovolumic shock, we have GI bleeding, trauma, vomiting, diarrhea, burns, and in third spacings. Cardiogenic shock will have left ventricular failure, right ventricular failure, ACS, and arrhythmia. So these are the four main types of shock which we'll be discussing in our subsequent lectures. So let us start the physical exam based approach toward shock. How can we diagnose shock on the basis of physical exam approach? So if the patient comes to you with a typical vitals and features of shock, so you want to know which type of shock it could be. So first step is asking yourself, what is the cardiac output? The manifestations of cardiac output, it is increased or it is decreased. If it is increased means the patient have fever, the patient's pulse pressure, difference between systolic blood pressure and diastolic blood pressure is increased, warm extremities, bounding pulses, and known or suspected infection. So this is the manifestation of increased output, cardiac output. If it is increased, most likely it is septic shock. In septic shock, we have cardiac output is increased. But if the cardiac output is decreased, we need to ask second question. And the second question, what is the status of GVP? GVP, jugular venous pressure, are the veins. Now we want to ask, the veins are empty or the veins are full? So this is our main question here. If the veins are empty, so it means in the history the patient will have a trauma, GI bleeding, burns, vomiting, diarrhea. It points us toward the hypovolemic shock. The patient having hypovolemic shocks. But if the veins are full, then we're gonna ask ourselves another question, that is third step. What are the breath sounds? If the breath sounds are clear or dependent crackles are there, if the breath sounds are clear, it means something is impeding the blood flow, and most likely it is an obstructive shock. And if the breath sounds are, we found dependent crackles, most likely it is cardiogenic shock. So remember, we need to ask three questions from ourselves. First is, what is the status of cardiac output? Second one, what is the status of GVP? And third one, what are the breath sounds? Most likely it will solve our diagnosis toward shock. So please keep in mind this chart. It will help you to diagnose these four main types of shock. And there could also be a mixed combo of shock. The patient can have hypovolemic shock, the patient can have obstructive shock, the patient can have cardiogenic shock and obstructive shock together. So You need to think about it. So, in upcoming lectures in this series, we are going to discuss step-by-step approach to each type of shock, their physical examinations, what you can find, labs, the vitals, the management of each type of shock in details. Please like and subscribe my channel. I hope you have learned something new. Thank you for watching.